Thank you very much, Mr. Chairman, and I appreciate your allowing several rounds of questions here, because we do need to get the details of the report understood and to evaluate them carefully. I would just like to start by indicating that many have said that those who don't support the bill are simply supporting the status quo, or that a vote against this bill is a vote for the status quo. And I couldn't disagree more. There is a robust debate here among all of us about what we need to do to reform health care in our country. But I don't know of a single member of this committee, frankly, nor a single member of the United States Senate who believes we should not do anything. And I agree with you and others who state that we need dramatically to place the reform of our health care system in our country on the front burner and to move aggressively forward to find workable solutions. The issue that I believe most Americans are crying out for resolution to is the skyrocketing increase in cost of health care that they face every year. Often, in fact, probably primarily in the form of skyrocketing insurance premiums that go up in double-digit amounts often year after year. And it's been said here that this proposal addresses that issue by bending the cost curve down. As has been testified here by Dr. Elmendorf, the CBO did not score that. And in fact, much of the analysis that I've seen indicates that in fact just the opposite is true. That in fact, the cost of insurance is going to go up above what it would have gone up if we enact this legislation, and that we are not really taking the kinds of aggressive steps that are going to address the things that are driving cost increases in our healthcare economy. And it's for that reason, among the others that I will mention, that I have a very difficult time supporting this measure as the one we should enact in order to address the issue. And in fact, even if you define the cost curve as simply the federal budget, I think the answers to my question today indicate that that doesn't drive down the cost curve either if you define it as the impact on spending at the federal level. I believe it's pretty clear from CBO's analysis and the answers to my questions today that there will be, and these are approximate numbers, about $829 billion of new spending, which itself is a little bit misleading because the spending in this bill doesn't really start in its full form for 4 years. And if you get a full 10-year look at what the numbers are, it's going to be greater than 829. That $829 billion of new spending on health care by the federal government is offset by about $400 billion of Medicare cuts and about $506 billion of taxes and penalties. Again, these are rough numbers, but I think that they're pretty accurate given CBO's score. Of that $506 billion of taxes and penalties, I'm going to have to work on this better before we get to the floor for the full debate, but a huge portion of that is going to be paid by people who make less than $200,000 a year individual, or $250,000 for a couple. And squarely, this will place about $500 billion of new taxes on the backs of the American people and of our economy, a huge portion of which will be on the middle class and lower income categories. And what do we get in return for it? Well, as I've already indicated, we don't, in my opinion, reduce the cost curve. We don't bend the cost curve, which is the number one reason that most Americans think we should address the issue. Number two, we do increase coverage, although with a very, very heavy hand of the federal government, and we will end up, though this particular bill does not have a government option in it, this bill has very extensive new increase and control of the healthcare economy by the federal government, and that will drive some increase in coverage. But even in the coverage area, we will still see of that 47 million uninsured number, about 25 million of them still uninsured. And I recognize and I will acknowledge that about 8 million of those, according to CBO's numbers, I believe, are those who are not citizens and who are not legally here. But even that leaves us. If you agree that we should not insure those who are not citizens of this country legally present in the country, you would still be left with about 15 or 16 million people uninsured. So the bill does not achieve one of the other major objectives that those calling for reform in our country request. What does it do? As I've indicated, it imposes a massive new amount of federal control over the healthcare economy. It increases taxes by about $500 billion, as I've already indicated. It cuts Medicare by a net amount of $404 billion. And we debated earlier in the mark about the impact of those cuts primarily falling upon Medicare Advantage that dramatically reduced the availability of Medicare to those who are seeking to use it. And in fact, while we have Medicare and Medicaid, two major federal entitlement programs, both of which are going to go off the cliff financially soon, instead of taking those Medicare savings to try to address and shore up Medicare, we instead are going to put those into a new federal entitlement program and an expansion of Medicaid, which, in my opinion, will not really address, once again, the pressing issues that our nation faces with regard to health care. And then the bottom line is, I could go on with other reasons, but the bottom line is when you look at the deficit reduction that the bill contains, it's about $81 billion, the entirety of which is off budget, meaning that it's Social Security Trust Fund dollars. If you take the Social Security Trust Fund dollars out of this analysis, the CBO score would be approximately balanced, zero, which means that you've cut Medicare and increased taxes enough to pay for about $829 billion of new spending. And like I say, that $829 billion is actually a much larger number because it doesn't count for the full 4 years of the first, or for the first 4 years of the first 10 years of the program. So, Mr. Chairman, we do want to work toward meaningful health care reform, but the health care reform our nation needs is health care reform that will reduce the cost curve for our health care economy, and health care reform that will not come at the cost of massive new taxes and massive new government control over the economy. Thank you very much, Mr. Chairman.